Chicago Tonight, Black Voices is made possible in part by Fifth Third Bank and by the support of these donors.
At Fifth Third, we believe when diverse voices are heard and empowered, communities are made stronger, lives are made better, and the future holds greater promise for all. That's why we're proud to support Chicago Tonight Black Voices. Together, we can make a difference. Together, we can drive change.
Good evening and welcome to Chicago Tonight, Black Voices. I'm Brandis Friedman. Thanks for sharing part of your weekend with us. On the show tonight, a feud over affordable housing in Woodlawn. The city lays out a Phase 1 plan, how residents are responding. A new survey focused on racism in healthcare, why a patient's experience could be a key factor in their overall health. In this week's Black History Month Spotlight, a doctor breaking barriers in medicine. A West Loop mural is honoring late fashion designer Virgil Abloh.
No single person can be him. That's why we have two performers playing him in this show.
And we preview a new theater production honoring a Black classical music composer of the 18th century. First off tonight, tensions and frustrations in Woodlawn as residents feel the effects of the incoming Obama Presidential Center. During the latest meeting on housing plans, the city presented what it calls a preliminary Phase 1 proposal. It would designate 13 city lots for the creation of deeply affordable housing. That means 15% of a building would be set aside for households earning between 30% and 50% of the area's median income. It's about $28,000 to $47,000 for a family of four. Another 15% of a building would be set aside for households earning at or below 30%. That's roughly $28,000. Now, AMI is calculated for the entire Chicago area. Now, it should be said the median income in Woodlawn is $24,450. The restrictions are part of the Woodlawn Housing Preservation Ordinance, which was put in place in 2020 to help protect residents from displacement and create new affordable rental and housing opportunities. Joining us now with more are Patricia Tatum, a Woodlawn resident and member of the Obama Community Benefits Agreement Coalition, which pushed for that ordinance, and 20th Ward Alderwoman Jeanette Taylor, whose ward includes Woodlawn. Thanks to you both for joining us. So, Patricia, I want to start with you, please. It seems like the city is agreeing to pre-identify 13 lots so far for deeply affordable housing. We know that the ordinance calls for a total of 52, but they say this is just one step. There will be more down the road. What is your reaction to this first part of the plan?
Well, our reaction is that the mayor needs to be accountable for the original agreement. And setting aside only 13 lots is not enough. We don't want her to keep pedaling on this. At first it was 20 lots, now it's 13. The original ordinance called for 52 lots, which is only a fourth of the city-owned lots in Woodlawn. 13 isn't enough. We need all of those lots along 63rd Street, close to where the Obama Center is going to be located, to be for affordable housing.
And why would you, Patricia, why would you prefer to have those lots closer to the Obama Center versus where the city is currently proposing?
So that the residents who've been here, who weathered the storms, who lived in Woodlawn, would be able to enjoy the Obama Center. At the rate we're going now, people are being displaced every day. Longtime Woodlawn residents are being displaced because they can no longer afford to live in this community. And we want residents who want to stay here to be given the opportunity to live in this community.
Alderwoman Taylor, same question to you. What do you think of the city's proposal to have a phased approach and starting with these 13 lots for the deeply affordable housing?
I agree with her. It's not good enough. The ordinance said 52. We should be doing 52. I don't disagree. Remember, this is an ordinance that myself helped push, and I was part of the coalition before I got into this space. And so just because I'm in the seat, my thoughts haven't changed. We have to protect people, as she said, who have weathered the storm and who want to live here. It is not fair that we're not going to get the investment that this community has been waiting for 20 or 30 years. And now the very people that we're supposed to protect are now being displaced. It's not fair, and it's not anything that I'm going to support or stand for.
Alderwoman Taylor, what have you been hearing? What's been the response from residents as they begin to feel the effects of the future Obama Center? And what are they saying about this latest proposal?
Every day I'm helping families to find somewhere to relocate and live, either because their landlords are realizing they can get more money for their property, or they're just refusing to take care of the property to force people to move. And so that's not right. That's not fair to my constituents. And so that's what I spend a lot of my time doing. And people need to understand, I'm paid to represent all the folks in the community. And the majority of the people who live here want to be able to stay regardless of what they make. And so shame on the city for not giving up those 52 lots. Like, let's have a real conversation about them. And there is a pushback in the community because there's a small percentage of people who live here who think that low-income housing or affordable housing comes with violence, which is just not true. It doesn't make sense, and it's not right. Just say you hate poor people, because that's what it feels like. I'm a renter. If I didn't have this job, I would be struggling to stay in the community like everybody else. And so the $700,000 homes that they're building in my community, I can't even afford. And so how do I expect people who the median income, as you said, is $25,000 to be able to afford to stay in the community?
Now, one issue that's come up throughout this process is how to fund the new affordable housing developments that are happening in Woodlawn. Housing Commissioner Marisa Novara touched on this process during Tuesday's meeting. Here's a bit of what she said.
When we talk about the commitment in the ordinance that a minimum of 10 highest density lots will have the 30 to 50% area median income, and that 52 lots are reserved for that. It's important to understand that we get that level of affordability only when we're doing rental housing, and we get that level of affordability when we are subsidizing the development. And our main way of subsidizing the development is through low-income housing tax credits.
So it may have been a little bit difficult to see Commissioner Novara there in the middle of the screen. It was a Zoom meeting, obviously. But Patricia, the low-income housing tax credits that the commissioner is talking about there, they come every 2 years from the federal government. Do you accept that this is the only way for the city to fund these developments?
No, we don't. We shouldn't have to rely on the city's low-income tax credits alone. Right now, we've got University of Chicago students standing with us who are demanding that the University of Chicago be involved in this and they could add to Black history. This community is full of history of Black people such as Lorraine Hansberry, who moved to this community to see a better life. University of Chicago could help it by funding housing. They're going to profit from the center, and they've long played a hand in displacement on the south side of Chicago. So they should be part of building back up and helping people to stay here, who want to stay here.
And we're almost out of time, but Alderwoman Taylor, this is obviously an ongoing conversation. What are the next steps? What's next for your office in about 20 seconds?
They need to be able to pull CHA state money from IDA to make sure that people are able to stay in the community. This is why the community was fighting for this way before now. And so we can figure it out. We figure out how to get the 78 done. We're figuring out this casino. We need to figure out how to be able to protect all the people who live in the Woodlawn community.
Okay, we'll have to leave it there. Obviously, more to come on this for sure. My thanks to 20th Ward Alderwoman Jeanette Taylor and Patricia Tatum for joining us.
Thank you.
Up next, racism in healthcare and how a patient's experience can impact overall health. A new study finds Black patients often have a different medical experience than white patients due to discrimination and inequities in healthcare settings. The survey from health news site Verywell Health reports 32% of Black Americans say they've experienced racism while dealing with the healthcare system. And 59% say racism caused them to stop or interrupt their treatment, whether that meant changing healthcare providers, not making a follow-up appointment, or delaying making a medical decision. Since the theme of this year's Black History Month is Black Health and Wellness, we're joined now by Aisha Jaco, Executive Director at Westside United, and Dr. Jessica Shepard, Verywell Health's Chief Medical Officer and the former Director of Minimally Invasive Gynecology at the University of Illinois, Chicago. Thanks to you both for joining us. Dr. Shepard, let's start with you, please. Why did you and the Verywell Health team want to take a look at the experiences of Black patients specifically?
Now, we know historically that African Americans experience, whether that's poor communication with their healthcare providers and also perceived discrimination when accessing healthcare. So this is an important part of our healthcare system, but even more importantly, what was that experience from the community that experienced itself? Now, we have a lot of data that shows where those discrepancies and where that healthcare disparities are, but we haven't really had good data on why that experience is within the Black community. And that's what we were able to do with this Black Health Experience survey.
Were you surprised by the results at all, Doctor?
It was one of those things where you kind of know what the answers are going to be, but when you see it, it is, again, staggering and very disappointing.
Aisha Jaco, Westside United's main mission is to reduce the life expectancy gap between downtown and Westside residents of Chicago. How does healthcare play into that?
So for us, when we think about decreasing that gap by 50% by 2030, healthcare is a driver of that. We do look at other social determinants of health, but in terms of healthcare, there are 5 main drivers of the gap between downtown and the West Side, and those range from cardiometabolic disease, so grouped in there, you have diabetes, you have stroke, there's cancer. A lot of people assume that homicide is a forerunner. It is in the mix, but it's not one of the top causes, along with opioid overdose and infant mortality or disparity, maternal child health disparity. So for us, we look directly at maternal child health disparity, where our East Garfield Park community has the highest disparity, and we look at hypertension management. So it's really around coordinating care across our 6 healthcare partners, making sure we standardize care so that no matter if you're a Black woman from Oak Park or the West Side of Chicago, you go in and you get the same level of care, whether you're at Cook County, Sinai, UI Health. So a lot of our approaches is around thinking about the best practices and how to leverage them across our systems, and then also having community-based practice that is accessible to our community members through the implementation of a community health worker model, or just things that people feel like are accessible and culturally competent and user-friendly to their ability to access those services and engage.
Now, one statistic that stuck out, Dr. Shepard, is how Black patients responded to racism. 36% say that it caused them to change healthcare providers. 28% said it caused them to delay making a health decision. 28% said they didn't make a follow-up appointment. 24% said that they stopped getting treatment altogether. It seems there's a correlation here between a patient's experience and how they address their own health. Could this also be a contributing factor to disparities in health outcomes?
You know, disparities in health outcomes are obviously going to be multifactorial, but when we actually look at those numbers, just like you stated, and looking at the experiences, this has a direct correlation with, example, what we were saying is hypertension. What does that look like as from a treatment perspective? And when we're seeing that 24% will stop treatment or 36% will switch their healthcare provider, which might create a gap in their actual management plan, and then 28% not following up with their appointment, that's going to lead to some stops in the care that they're being given. And also, what is that management plan and how is it going to carry out in order to have better outcomes of health? So yes, this is directly correlated with what we're seeing with chronic illnesses. And when we think of maternal mortality and those numbers, those are going to be higher when you look at statistics like this from the experience and how they have experienced racism and what they do with that.
Aisha, what are some of the solutions to reducing the health gap and disparities in outcomes?
Well, we believe that it's very important to bring community to these tables, to have discussions, to frame the interventions and frameworks that they will react to help address the systemic racism that has prevailed in the healthcare system for almost a century, to think about models and protocols from entities like the American Medical Association and their partnerships with Essence Magazine and the Release the Pressure campaign that are culturally competent attempts to make sure people have access and that they take their health into their own hands. And so we think having community play a role in building that and giving us insight on how to best implement those strategies, whether it's in a church, a school, a place where people are congregating, and we have those connections into healthcare through trusted messengers and resources. So it's really around starting there where people are most impacted so that we don't come in with something that people are not going to respond to, so that we don't overpromise and underdeliver based on what we know to be true, but that it's truly a partnership led by the people who are impacted most. So that's one of our strategies.
Dr. Shepard, what more could the medical community be doing to sort of level these disparities?
Well, one way that we can do that is representation. This is something that is, I think, quite absent in the medical community, even stemming from, how we are able to get representation in medical school and into the providers that we have, because this survey also showed that 49% of Black Americans have racism within their experiences, have confidence that healthcare providers and even the health institutions have their best interest at heart. So that's even a statistic that shows that if they're not seeing representation in who they're seeing as healthcare providers, or the communication that they have with their providers of people who feel like they do or have the obstacles that they do or understand that, you're going to see that, one, there is a decrease in the actual interaction between a healthcare provider and a patient, but also the carry-on of their management and treatment plans, which are really crucial in how we see chronic diseases in our Black community.
Okay, that's a good place to leave it. My thanks to Dr. Jessica Shepard and Aisha Jaco for joining us.
Thank you.
Thank you.
Up next, a tribute to late fashion designer Virgil Abloh. Chicago's first mural honoring the late fashion designer Virgil Abloh is now standing in the West Loop's Time Out Market. It was created by Raman Static and curated by LeVar Horde of Beeline Projects, a local organization that works to preserve murals throughout the West Loop. Comprised of 4 to 5 different graffiti styles, Horde says the mural not only reflects elements that inspired Abloh, but what he did creatively for the city.
You're going to see late 70s, early 80s graffiti styles in there. You're going to see Virgil's first sort of notepad sketch of his graffiti tag, which was Verge, V-E-R-G, with stars. It appears right next to his face. He later changed that to V-I-R-G with bubble letters, and that's on his tie. And behind him, you'll find arrows and clouds and things, a real example of wild style graffiti. Virgil set a foundation and opened a dialogue. And here we are talking about a style of art and a period of culture and what was behind Virgil's designs and what made him such a good designer, right? Because it was not just about the sort of superficial nature of fashion as some people see it. This was a modernization of Black culture and street style. And so those are incredibly important lessons to offer to the future generations. And simply by looking at a mural and swimming through the details and inquiring about those details, everything is full of intent and imbued with love and inspiration that came from Virgil.
The Louis Vuitton artistic director, fashion designer, and entrepreneur died late last year after a private battle with cancer. You can visit the mural at Time Out Market in the city's West Loop neighborhood through the end of the year. Musician, friend to Mozart, music teacher to Marie Antoinette, and skilled fencer. Those are just a few of the accolades that describe the man known to be the first Black composer of the 18th century. Arts correspondent Angel Edo introduces us to the Chevalier.
After all, you are an immigrant just like me.
Meet Joseph Bolognais, Chevalier de St. George. Well, not the real him, of course.
Who are they? I could hear you asking it.
The king has created a new force, La Police de Noir.
He's said to be the first Black French composer of the 18th century. His life and legacy are now being highlighted in a new production titled The Chevalier.
We fight for slavery's abolishment, Mozart.
It's all about this intriguing, incredible man who John Adams described as the most accomplished man in Europe, a fencer, a composer, a violinist, a crusader for abolishing slavery, a real Renaissance man. And this friendship with Mozart, really, Bill centered this whole play around that particular fortunate coming together of these two great figures in Paris in 1778.
Le coup de grace!
It's written and directed by Bill Barclay of Concert Theater Works, who is also an actor in the show.
We're trying to provide a deeper survey of his music. There are 16 different movements of his music represented in the show. And there's also his life, his psychology, his sense of humor, his relationship to fencing, how he was knighted, his relationship to all these other characters who are much more famous than he, to try to lift up this man's biography in our understanding, replace him where he belongs in our music history, and honor him. No single person can be him. That's why we have two performers playing him in this show. We have an actor and we have a violinist. There isn't anyone on planet Earth who could be the Chevalier of Saint George.
On the musical side stands Brendan Elliott. What does it mean to embody such a prominent classical composer?
Playing this role feels a little unreal, because it makes me realize how hard he really worked to, carve out this entire life for himself.
Elliott is accompanied by the music of the Baroque Orchestra, conducted by Dame Jane Glover. This partnership aims to contextualize the Chevalier's music with both his life story and compositions.
And there weren't many like him. I mean, he really was a sort of one-off who survived spectacularly against so many odds. When he and Mozart came together, they were both outsiders. And in a way, it was Boulogne who had more stacked up against him, who survived better.
Boulogne is coming out of the galant style of early classical Parisian music. It sort of ends with Boulogne, as Boulogne stopped composing and started fighting in the revolution. He actually ended it himself by deciding that there was something more important to do, abolish slavery.
Winner, winner, chicken dinner.
On the acting side stands R.J. Foster. Now, despite just recently learning about the multifaceted artist, he says there are still many parallels between the 18th century production and today.
You have a black man who has a title, he has some influence, but also he deals with racism. And it's in a different sort of way than which we deal with here, but it's also mirrors it in the same sort of way. Culture is a social lubricant. It kind of helps to tell stories that are relatable to people.
We fight for slavery's abolishment, Wolfgang. That is why my address must stay strictly private, understood?
For Chicago Tonight Black Voices, I'm Angel Ito.
You can see this production of The Chevalier through Sunday. Visit our website for more information. Continuing our Black History Month series of spotlighting a Chicago Black history maker, this week we're introducing you to Dr. Roscoe Conkling Giles. He was born in 1890 in Albany, New York, but he's known in Chicago for studying at Provident Hospital, which was founded and owned by African-American Dr. Daniel Hale Williams. Then, at 27, he became the first African-American to lead a city health department by becoming supervisor of the Chicago Health Department. We spoke with Chicago's urban historian Sherman Dilla Thomas about how his contributions resonate today.
Obviously, especially going on today in the pandemic, there's been a lot of trepidation about vaccines, not vaccines, and just healthcare in general. And one of the reasons why is because people of color don't necessarily see themselves when they go to an office. Roscoe Conklin Giles is a prime example of being able to kind of push through those stereotypes and proving that it's possible for us to not only enter in the medical field, but to succeed. He had way less resources as it relates to like studying and getting through medical school than we have today. So he should for sure serve as an example of what's possible.
Conklin Giles is also the first African American to earn a medical degree from Cornell University. He died in 1970 in Chicago at 79 years old. And that's our show for this weekend. Be sure to check out our website, WTTW.com/news, for the very latest from WTTW News, including details into Mayor Lightfoot's plan to sue Chicago gangs. And if you're watching us on Saturday night, know that you can also catch Black Voices and Latino Voices on Sundays beginning at 10 p.m. And join me and Paris Schutz next week at 7 on Chicago Tonight. We leave you tonight with more music from the production The Chevalier. Now, for all of us here at Chicago Tonight Black Voices, I'm Brandis Friedman. Thanks for sharing part of your weekend with us. Stay healthy and safe, and have a good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a personal injury law firm pleased to give back to the community through numerous charitable initiatives.